direct treatment at each of those symptoms.
All right. What symptoms, what types of symptoms could you expect based on that hyperdrive mechanism?
Blood pressure elevation, heart rate elevation, again, all the things I mentioned previously, sweating, severe anxiety, agitation, discomfort, crawly skin, abdominal cramps, nausea, vomiting, diarrhea, severe bone pain, and in its worst forms that you can see fever elevation and other objective somatic signs.
Now, let's talk about rapid detox for a little bit. That involves actually creating this, stimulating the withdrawal process. Is that right?
Not my field of expertise or experience.
Do you know why in rapid detox programs they require ventilation, general anesthesia?
I would put it in the reverse order. They require the general anesthesia to tolerate the discomfort. If you look at an opioid antagonist product information, one of the things that it will say is that you can diagnose addiction by administering an opioid antagonist, because if someone is active in their opioid use, they will go into immediate severe withdrawal. So if you're going to administer that drug to someone who's admitting to you and coming to you for help for opioid withdrawal, you better be prepared to immediately ameliorate all of those symptoms. So someone invented, so to speak, the methodology of putting somebody under general anesthesia, and then therefore you need ventilatory support, which is why I put it in that specific order. And subsequent to that, you can infuse intravenously an opioid antagonist, and the patient goes into withdrawal while they're under general anesthesia.
One moment, please. Does one of our jurors need a tissue? Don't hesitate, Juror 11. Do you have one, Mrs. Theodoro? It was on the side of Dr. Waldman. Could you give that to Mrs. Theodoro? You're welcome. Keep the box for now. Thank you.
May I, Judge?
You may.
One of the concerns with withdrawal or detox is our physical. Actually, one of the concerns is with the heart as well. Is that right?
Well, it's stressful. It's definitely a physical stress to undergo.
And it's stressful to the respiratory system? Is that correct? Which parts of the body would you say it was stressful to? Which systems?
Which form of detox are we talking about?
Rapid detox?
Rapid detox is stressful because you're undergoing general anesthesia. And general anesthesia and ventilatory support and assistance have their own mortality and morbidity, separate and distinct from the mortality and morbidity associated with opioid withdrawal. And again, they're necessary because that individual is about to experience an unbelievable amount of discomfort and pain. It could not be tolerated if you weren't asleep.
All right. What about ordinary detox? What stresses on what parts of the body, what systems in the body?
Primarily nervous system with anxiety and insomnia, and cardiovascular. There's like any other medical problem or illness, there's degrees and variability, and a lot of it's very individual. So many people experience opiate detox but are not terribly uncomfortable, and some people experience opioid detox and are tremendously uncomfortable. It's extremely idiosyncratic. It's not predictable. The main stress is really, again, heart rate increase, blood pressure increase, but you're aware that those are going to happen, and so you're, so to speak, pre-treating them. You don't wait for someone to experience them. You provide medication proactively. In
addition to the variability of the symptoms, there's also variability in the length of time that the withdrawal would peak. Is that fair to say?
Yes.
An individual might, for instance, start withdrawal symptoms in 12 hours. A particular
Yes.
individual might.
Yes.
The peak may hit in 72 hours. Depends on the individual.
It get highly variable.
All right.
And some people never really experience bad withdrawal. It's a very idiosyncratic individual thing. What makes it more challenging is that, again, people with addictive disease are not generally accurately representing their precise use. Some embellish it, some undervalue it, and so you have to be prepared that you might be over or under medicating.
All right. Now, when I came to see you, well, to hire you on this case, Dr. Waldman, we talked a little bit about addiction, but I also wanted you to review some information. Is that right? I provided you some information to look at.
Yes.
And one of the things that I asked you to look at were medical records.
Yes.
Is that right? I'm going to mark this exhibit as UUU, useful, useful, useful.
Triple uniform.
Could you spell that?
How many pages?
It identifies itself as having. Let me make sure that it's correct. Let me count. Make sure it's correct, Judge. If that's all right. I don't want. I have 36 pages, Judge. I'm going to. That's what I've got on this. It doesn't say that on here, but that's what I've counted. 36 pages on UUU.
Thank you.
One of the things that I asked you to review, Dr. Waldman, were the medical records of Michael Jackson. Is that right?
Correct.
And these were medical records that were provided to us pursuant to subpoena from Dr. Arnold Klein's office.
Yes.
And I asked you to review these pages that were provided by Dr. Arnold Klein's lawyer and take and look at the treatment that had been given to Michael Jackson. Is that right?
Yes.
In addition to these medical records, I also asked you to review other things. Is that right?
Yes.
Statements from witnesses.
Yes.
Testimony from witnesses.
Yes.
Now, I want to go to these records. I want to go to some specific days, and we're not going to go through every day, but I want to go through some specific days. The records that were provided to you were for a particular period of time. Is that right?
Yes.
All right, and I believe the records begin in January, and they end on the 22nd of June. Is that correct?
To the best of my recollection.
All right.
Of what year, please?
2009.
Is that right, sir?
Yes.
Thank you.
I want to go to a particular day. I'm going to start on March 12th, 2009, Doctor. All right? And I'm going to show you a record from these medical records, a page from these medical records. And by the way, when I provided you these medical records, you asked me if they were complete. Do you recall that conversation that we had?
Yes.
And I told you that
Objection. Counsel's testifying here.
The objection sustained.
is there any particular way for you to make that determination whether records are entirely complete by looking at what was provided?
Not that I'm aware of.
All right.
Do you have a copy that I can look at here? It'll be more clear.
I do not. I do not. Can you see that? Is it possible for you to
It's
see
challenging.
that? All right, I'll go back and forth.
Okay.
All
And
right.
if you have to
Yes.
approach Dr. Waldman, you do that with the hard copy.
Thank you.
Sure.
Is this something you can see? Can you see it? All right. We see here on this record that's dated on the 16th of March. I'm sorry, the 12th of March. I apologize. On the 12th of March, thank you, Monsieur. A patient name of Omar Arnold. Do you see this?
Yes.
All right, and I've told you that this is the name that Arnold Klein used for Michael Jackson, Omar Arnold. Is that right?
Yes.
Okay. And we see here that this is a page from March 12th. Can you explain, please, so ladies and gentlemen of the jury, what treatment is being described here on this page?
You're going to have to hand me a copy. I'm
I will.
visually challenged here.
Okay, I will.
If I wear my contacts, I can't read. If I wear my glasses, then I won't be able to see in front of me.
It's okay. I'm going to turn on the bank of lights by Dr. Waldman. You can put it on freeze, though.
Yeah. Oh, that's right.
Remember
Thank
that?
you. Yes, thanks, Jeff. That's right. All right, let me try that first, and then I'll go over to him. Thank you.
That'll help out all of us.
Yeah, really. Okay, let me see here. Look at that. Thank you.
Thank you.
Technology.
Let me show you the notation of March 12th, Dr. Waldman. Can you see that now?
I'm good now.
Okay. Now, we're looking at this record here from March 12th. Can you tell us, describe to us what kind of treatment is being provided here on March 12th by this record?
I want to preface by saying I do absolutely no office dermatology, but I'm going to interpret the writing. March 12th, 2008, I believe that's restyling / Botox on the top line next to the date. Underneath that, Demerol 100 milligrams, midazolam 1 milligram, IM, LUQ, left upper quadrant. There's that looks like that's initialed by someone. At 12 p.m., Demerol 100 milligrams, IM, left upper quadrant. Again, initialed by somebody, and I think those initials are EP. And underneath that, it says restyling 1.0 cc times 1. It has the lot number for the restyling.
We have two medications that are listed there, or two words, Botox and Restylane. Do you see that?
I do.
Do you know what Restylane is?
I believe that it's an injectable filler for wrinkles or something like that. It's not something I've ever used.
All right. But you're familiar with it.
Not really.
All right. What about Botox?
I'm only familiar with Botox the way we're colloquially familiar with Botox, that it's, again, an injectable for wrinkles and things like that.
Do you know, have you, as a result of this case and as a result of this review of these materials, have you made a determination about whether or not Botox or Restylane are painful procedures?
No.
Have you spoken to any of your plastic surgeon friends, your dermatologist friends?
Objection, ask and answer. You make no determination.
I'll overrule the objection. You may inquire.
Have you done that?
I have.
And have you, as a result of that, made a determination about whether you believe that that there would be a substantial amount of pain for these procedures?
The information that I received was that the standard of care would not involve administration of a strong opioid, IM, for Botox or Restylane.
Non-responsive, motion to strike.
Sustained. The last answer is stricken. Disregard, please.
Thank you. You are familiar with what Demerol is, right?
Correct.
And we see that
Overruled.
100 milligrams of Demerol was administered to Michael Jackson at 11:30 a.m. Is that what it says?
Yes.
And then along with 1 milligram of midazolam.
Yes.
Do you know what midazolam is?
Yes, it's a benzodiazepine sedative.
All right. 30 minutes later, the records show another Demerol shot of 100 milligrams.
Yes.
In your view, is there anything significant about how... Let's start with the amount of Demerol that has been administered on this particular day.
Stiff doses. They're above average doses.
All right. When you say above average doses, what would be for an opiate naive individual, what would be an average dose, a reasonable dose?
A starting dose that's recommended for an opiate naive individual would be 50 milligrams.
Explain what an opiate naive individual is.
Someone who had never had any recent contact with opioid medications.
Now let's assume, for the sake of argument, just for the sake of argument, that Demerol shot, and this is an intramuscular shot, is that right?
Yes.
That a Demerol shot was necessary, or Demerol was necessary for Botox, or Restylane for that matter. Would 200 milligrams be a surprising amount to you?
Yes.
How surprising?
It's just a large dose.
If 200 milligrams were given to an opiate naive individual, someone who is not used to getting these medications, what would occur? What would happen?
I believe the patient would be sleepy, lethargic, possibly difficult to arouse, possibly unresponsive. Again, idiosyncratic reactions to opioids occur all the time. There's no good way to predict how someone is going to respond. You start with a small dose, observe, and work your way up if necessary. But I would suggest that 200 milligrams over 30 minutes is a large dose.
All right, let's go to... May I?
Please.
Sorry.
I'm going to go to March 17th. On these records. Can you tell us what the treatment was on this day?
Similar treatment, but no Botox.
All right, and similar Demerol shots.
Yes.
One at 10:45 and another one at 11:45. Is that right?
Correct.
Are you familiar with the physician's desk reference suggestions for Demerol? Have you looked at those?
No. Other sources.
Do you happen to know what the recommended top limit of a Demerol shot is? What suggestion is?
Yes.
What is it?
600 milligrams in 24 hours.
All right. Now, do you know what the recommendation is for each individual shot? The limits to that?
I don't believe that there is one.
You're not familiar with one?
Your goal is pain relief. And so depending upon the degree of pain, you'll give an adjusted, appropriate dose.
All right. Here we have one at 10:45 and one at 11:45. Is that right?
Correct.
For a total of 200 milligrams of Demerol. Is that right?
Correct.
I want to move forward through these medical records, and you would agree with me that throughout these medical records are these exact types of references: Restylane, Botox, Demerol, Midazolam. Is that right?
That's my recollection.
All right. I want to move to the month of April and look at what these records show for the month of April. I'm going to start with April 2nd and April 6th, and I'd like you to read, please, into the record what we see here. What was provided on the 6th of April at 8 p.m.?
Demerol 200 milligrams and midazolam 1 milligram IM LUQ, left upper quadrant.
And this was one shot, in one shot.
Yes.
All right. Let's turn to, from April 6th, I'd like to turn to April 9th. And we see, once again on April 9th, at 3:30 p.m., you can't see. I forgot. Tell us what treatment was provided on April 9th.
3:30 p.m. Demerol 200 milligrams, midazolam 1 milligram IM RUQ, right upper quadrant.
All right. And then on April 13th?
11:15 a.m. Demerol 200 milligrams and midazolam 1 milligram IM LUQ, left upper quadrant.
All right. And this is Restylane on both days, the 9th and the 12th, is what it suggests?
Correct.
13th or 12th?
13th.
13th. Thank you.
Thank you.
Let's go to April 15th. Tell us, please, what was provided on this day to Michael Jackson.
Demerol 200 milligrams and midazolam 1 milligram IM, right upper quadrant.
All right. And then once again, a 200 milligram shot.
200 milligrams with 1 milligram of midazolam, yes.
All right. This is April 17th. And we see in these records, once again, what types of treatment.
Botox in the axilla for perspiration. Axilla is medical term for armpit. Demerol, 7 p.m., Demerol 200 milligrams and midazolam 1 milligram, left upper quadrant. 7:30 p.m., Demerol 100 milligrams and midazolam 1 milligram, right upper quadrant.
And this was at 7 and 7:30 p.m., these two shots.
Correct.
For a total of 300 milligrams of Demerol, right?
Correct.
And 2 milligrams of midazolam.
Correct.
And midazolam, and each of these shots were given 30 minutes apart. Is that right?
Correct.
Well, let's go to the next day on these records, the 21st of April. Tell us what is reflected on the 21st.
Again, Botox, this time to the groin for excessive perspiration. 10:30 a.m., Demerol 200 milligrams and midazolam 1 milligram IM, left upper quadrant. 11:30 a.m., Demerol 100 milligrams IM, right upper quadrant.
Now, as you see, Dr. Waldman, as you see these days progress, we go from 200 to 300. Is that significant to you as an addiction medicine specialist?
Yes.
And of what significance is that to you?
It implies that he's no longer getting a therapeutic effect from the prior dosage, and this is consistent with the development of tolerance.
Let's go to... Now, you have already testified that 200 milligrams that was provided in March would suggest that Michael Jackson was not opioid naive, right?
Correct.
And does that also suggest a physical dependence or tolerance of Demerol?
I don't have prior records, so my assessment would be, again, that those are large doses for an opioid-naive person for a dermatologic procedure in the office. And now we have increasing doses of the same medicines. That is consistent with the development of tolerance to the effect of the smaller dose.
Let's go to the next day. This is the 22nd of April. Can you show us what's reflected by this day, the 22nd of April?
11:30 a.m. Demerol 200 milligrams and midazolam 1 milligram IM, left upper quadrant. 12:30 p.m. 100 milligrams of Demerol and midazolam 1 milligram IM, right upper quadrant. And then at 1:30 Demerol 75 milligrams IM, left upper quadrant.
Can we, Dr. Waldman, can we say that this further represents an escalation in the use of Demerol?
This is a large dose. And yes, there is evidence for increasing dosage.
This dose, this 375 milligrams that were given that afternoon or morning, is that the kind of dose you would expect for Botox?
Answered beyond his area of expertise.
Sustained.
Well, have you ever given Demerol?
Yes.
When did you give Demerol?
Objection relevance wasn't for Botox.
I'm sorry. The objection is sustained. If there's a partial answer, it's disregarded.
Have you ever given 375 milligrams of Demerol?
Objection relevance.
No.
I'll overrule the objection.
No.
Let me show you the next day, which is the 23rd. This day we see that Michael Jackson came in and received 100 milligrams, it says, of Demerol, and it says 1 milligram of midazolam. Is that right?
Correct.
So during these 3 periods of days, 22nd, 23rd, and 21st, all total, how much Demerol did Michael Jackson receive?
Please tell me those dates again.
21, 22, and 23?
'21, '22, '23?
Yes.
Those are 3 days? Okay. 300 on the 21st, 375 on the 22nd, makes 675 milligrams, and another 100 on the 23rd, 775 milligrams
In 3 days.
in 3 days.
Let's go on to, thank you. Let's go on to the 27th of April.
By any chance, is there an extra copy? Because
If I had known
you're getting a lot of mileage.
I know. I agree.
And it's tough to hear counsel when counsel's between mics.
Dr. Waldman, how are you with the iPad? Can you do it?
Your Honor, I'm willing to take a shot at it.
No, I don't want you to do that.
I can see it. I just want to make sure I do it exact.
And that's why you should have it in front of you.
Okay, thank you.
If there's any issue here. That's our responsibility. Just wonder if there's another copy.
Can you use the iPad?
Sure.
All right. May I approach?
You may.
I may go internet and check the sports.
Rather than go through this exercise, it's probably better to just wait a moment and we can photocopy it, back to the old reliable standard. Because we're taking a lot of time
He has it.
on movement. Oh, you got
He
it?
does.
I do, Judge.
Because you let me know if you think it's preferable to make a photocopy, we can do that very quickly.
We're good. Thank you, Judge.
Thank you.
This is April 27th. Can you tell us how much Demerol was provided on this day?
11:30 a.m., 200 milligrams IM, and midazolam 1 milligram IM, left upper quadrant. 12:30 p.m., Demerol 100 milligrams, and midazolam 1 milligram IM, right upper quadrant.
300 milligrams.
300 milligrams.
Let's go to April 30th. You have that, Doctor?
I do.
All right, April 30th, how much Demerol was provided to Michael Jackson on that day?
12:30 p.m., 200 milligrams Demerol IM, and midazolam 1 milligram IM, left upper quadrant. 2:30 p.m., Demerol 100 milligrams, and midazolam 1 milligram IM, right upper quadrant.
All right. May 4th, how much Demerol was provided?
10:30 a.m., 200 milligrams, Demerol 200 milligrams, and midazolam 1 milligram, left upper quadrant. 12:30 p.m., Demerol 100 milligrams, and midazolam 1 milligram, right upper quadrant.
Dr. Waldman, have you considered, in reviewing these records, have you considered, and I understand that they're based on records alone, have you formed an opinion about whether or not by May 4th, or at least, or even earlier, that Michael Jackson was dependent on Demerol?
Yes,
What is that opinion?
I believe there's evidence that he was dependent upon Demerol.
What about addicted?
Possibly.
Possibly.
My
What would
my
you-
opinion is that based on my prior definition and what's known about his public behavior and this course of treatment, that he was probably addicted to opioids.
Now,